Hello guys, welcome back to my channel. Kindly watch until the end of the video and please do like, share and subscribe. Let's see how smoking affects the lungs and how long does the lungs takes to recover after you quit smoking. Cigarette smoking is the leading preventable cause of death, killing up to half of its users. Tobacco kills more than 8 million people each year. More than 7 million of those deaths are a result of direct tobacco use, while around 1.2 million are the results of non-smokers being exposed to second-hand smoke. Many of the chemicals in cigarettes, like nicotine and cyanide, are poisons that can kill in high doses. Our body is smart, so it goes on the defense when it's being poisoned. First time, smokers often feel pain or burning in their throat and lungs, and some even throw up for the first times they try tobacco. Over time, smoking leads to health problems such as heart disease, stroke, lung damage, and many other types of cancers. The primary role of lungs is delivering oxygen-rich blood throughout the body. You breathe in oxygen and breathe out carbon dioxide as waste exhalation. Damage to the lungs, however, can quickly cause a noticeable difference in the ability to breathe easily. How does smoking affect your lungs? When you smoke, the tissue of lungs receive damage, impeding them from functioning normally. Smoking also increases your risk of serious health issues like lung cancer, chronic obstructive pulmonary disease, emphysema, and so on. Upon your first puff, immediate damage to the lungs begin. Every puff of cigarette smoke contains over 7,000 chemicals. These chemicals can transform normal cells into cancer cells. When you inhale, the smoke hits your lungs almost instantly. The blood then carries these toxic chemicals throughout the body. Carbon monoxide and nicotine are one of those toxic chemicals. Carbon monoxide is a harmful gas you inhale when you smoke. Once in your lungs, it is transferred to your bloodstream. Carbon monoxide decreases the amount of oxygen that is carried in the red blood cells. It also increases the amount of cholesterol that is deposited into the inner lining of arteries, which over time can cause the arteries to harden. This leads to heart disease, artery disease, and possible heart attacks. Nicotine. Nicotine is a dangerous and highly addictive chemical. It can cause an increase in blood pressure, heart rate, and flow of blood into the heart. Nicotine may also contribute to the hardening of arterial walls, which in turn may lead to heart attack. This chemical can stay in your body for 6 to 8 hours depending on how often you smoke. Also, as the most addictive substance, there are some side effects with withdrawal. Consequences of smoking. Cigarette smoke has negative consequences for individuals of all ages. Babies born to mothers that smoke during pregnancy may have abnormal lung development. Teens who smoke may develop weaker lungs which never operate at full capacity or develop to their full adult size. Additionally, smoking can destroy the cilia. These tiny hairs in the airway keep dirt and mucus out of your lungs. This may then lead to the development of smoker's cough, a chronic cough common for long-term smokers. Smokers are also at risk for chronic obstructive pulmonary disease and lung cancer. 80% of cases of COPD are due to smoking. People with COPD have difficulty breathing and eventually die because of lack of oxygen. COPD has no cure. The top cause of cancer death is due to smoking. Smokers are 20 times more likely to develop lung cancer than non-smokers. Lung cancer may also lead to other respiratory cancers. Smokers aren't the only ones affected by tobacco smoke. Secondhand smoke and vapor is a serious health hazard for non-smokers, especially children. Non-smokers who have high blood pressure or high blood cholesterol have a greater risk of developing heart diseases when they are exposed to secondhand smoke. Secondhand tobacco smoke contributes to thousands of premature heart disease and lung cancer deaths. Studies show that the risk of developing heart disease is about 20 to 30% higher among the people who are exposed to environmental tobacco smoke at home or work. Secondhand smoke promotes illness too. Children of smokers have many more respiratory infections than children of non-smokers. Secondhand smoke can cause health problems such as wheezing, chronic cough, increased mucus, shortness of breath, trouble controlling asthma, pneumonia, and lung cancer. Smoking can cause cancer almost anywhere in the body. Smoking can increase your risk for cancer of bladder, throat, mouth, kidneys, ureter, cervix, pancreas, colon, rectum, esophagus, larynx, liver, oropharynx, stomach, trachea, bronchus, and lungs. Once you start, it's hard to stop. Smoking is a hard habit to break because tobacco contains the very addictive chemical nicotine. The best way to ensure lung health is to never start using tobacco, but if you are already an addicted smoker, the sooner you quit, the sooner your lungs can begin to heal. Quitting smoking can lower the risk of getting cancer. Quitting smoking and its reduced risks. After 1 hour, as little as 20 minutes after the last cigarette is smoked, the heart rate drops and returns to normal. Blood pressure begins to drop and the circulation may start to improve. After 12 hours. Just after 12 hours without a cigarette, the body cleanses itself of the excess carbon monoxide from the cigarettes. The carbon monoxide levels returns to normal and the body's oxygen levels increases. After 1 day. Just 1 day after quitting smoking, the risk of heart attack begins to decrease. Also, the blood pressure begins to drop, decreasing the risk of heart diseases from smoking-induced high blood pressure. After 2 days, smoking damages the nerve endings responsible for the senses of smell and taste. In as little as 2 days after quitting, a person may notice a heightened sense of smell and more vivid taste as these nerves heal. After 3 days. 3 days after quitting smoking, the nicotine levels in a person's body are depleted. While it is healthier to have no nicotine in the body, this initial depletion can cause nicotine withdrawal. Around 3 days after quitting, most people will experience moodiness, irritability, severe headaches, and cravings as the body readjusts. After 1 month. A person's lungs function begins to improve. As the lungs heal and lung capacity improves, former smokers may notice less coughing and shortness of breath. After 9 months, the lungs have significantly healed themselves. The delicate hair-like structures inside the lungs, known as cilia, have recovered. Around this time, many former smokers notice a decrease in the frequency of lung infections because the healed cilia can do their job more easily. After 1 year, the risk of heart disease will decrease by half. After 5 years, the body has healed itself enough for the arteries and blood vessels to begin to widen again. This widening means the blood is less likely to clot, lowering the risk of stroke. After 10 years, a person's chances of developing lung cancer and dying from it are roughly cut in half compared with someone who continues to smoke. The likelihood of developing mouth, throat, or pancreatic cancer has significantly reduced. After 15 years, the likelihood of developing coronary heart diseases is equivalent to non-smokers. Similarly, the risk of developing pancreatic cancer has reduced to the same level as of non-smokers. After 20 years, the risk of death from smoking-related causes, including both lung disease and cancer, drops to the level of a person who has never smoked in their life. Also, the risk of developing pancreatic cancer has reduced to that of someone who has never smoked. Thank you for watching. Hope you guys like this video and see you all in next video.